Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as Nortriptyline. Its brand name is Aventyl. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source of recommendations for your personal health care. Nortriptyline is broadly classified as a non-selective cyclic antidepressant, and more specifically as a tricyclic antidepressant, or a TCA. There are several different indications for using nortriptyline. One is it's used in major depressive disorder, or MDD. This can be acute treatment or maintenance therapy. It can be used to treat depression that is secondary to other mental illnesses, such as schizophrenia or dementia. It can sometimes be used to treat the depressed phase in individuals who have bipolar. Some individuals who have trouble sleeping may use nortriptyline. And some situations where nortriptyline is used a little less often would be panic disorder with agoraphobia. It can be used in specific depression following a stroke. Some individuals may try nortriptyline to treat their PTSD or post-traumatic stress disorder. It can be used to treat temporomandibular joint disorders. Some individuals with ADHD may try nortriptyline if they're not responsive to other agents. It has been used in premenstrual dysphoric disorder as well as smoking cessation. In smoking cessation, it has been used alone as well as with a nicotine patch. There are some other off-label uses as well that we won't get into in this video. Now, before somebody was to use nortriptyline, there are some precautions that they should be made aware of. One is that it should be used cautiously in individuals whom anticholinergic activity may cause them harm. This could be somebody suffering from urinary retention, prostatic hypertrophy, or narrow-angle glaucoma. It should also be used cautiously in individuals who have respiratory difficulties, as the use of these medications, because of their anticholinergic activities, can cause a decrease in secretions in the lungs and make breathing difficult. Nortriptyline does have the ability to lower the seizure threshold, so it may be a good idea to avoid or use cautiously, again, in individuals who have a history of convulsive disorders. Because of the sedative effect that some people experience with nortriptyline, it may reduce your ability to perform hazardous tasks, such as using heavy equipment or driving an automobile. It's best to avoid doing such tasks until you know how the medication makes you feel in terms of that sedation. This medication may induce mania in up to 50% of individuals who use it with bipolar disorder. Over the years, many physicians began to avoid using nortriptyline in such patients. Using nortriptyline with an SSRI may lead to an increase in plasma concentration of nortriptyline. This is one of the reasons why we typically only combine these medications in individuals who have that resistant depression. Using both of these medications together as well will put patients at an increased risk of serotonin syndrome. Although this medication can typically be taken with or without food, you shouldn't take it with foods that are laxatives or high in fiber, as they may decrease absorption. Now, once somebody is made aware of the precautions and they start using nortriptyline, they'd most often be taking this in capsule form. It's available as a 10 and a 25 milligram capsule, and doses are typically initiated at about 10 milligrams taken at bedtime. The medication is started off on a low dose to decrease your risk of having side effects. It will then be increased over time to a target dose of 25 milligrams daily, or 50 or even 100 milligrams daily. Some patients may require a higher dose in some situations. As with all medications, there are some side effects or adverse reactions that people may experience while using nortriptyline, so I'll list some of those side effects here for you now. Drowsiness and sedation, as well as insomnia, happens in about 2% of people using it. Over 2% of people may have a feeling of excitement or even hypomania. Disorientation and confusion are more common. They happen in over 10% of people. Headaches happen in less than 2% of individuals. And general fatigue happens over 10% of the time. Some people do experience the anticholinergic side effects that we touched on earlier in the video, so that would be sweating, blurred vision, urinary retention, constipation, or dry mouth. Of these 5 side effects, dry mouth and constipation happen over 10% of the time, and the other 3 happen less than 2% of the time. Some people experience extrapyramidal side effects, such as tremors. Over 10% of people experience orthostatic hypotension, as well as changes on an ECG. GI distress, weight gain, sexual dysfunction, as well as some other side effects that are common with other antidepressants that we talked about in previous videos, aren't as common with this medication. They only happen in about 2% of people. That's all we're going to talk about today with nortriptyline, or Aventyl. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's some links in the description you can check out as well. That's it for today. Take care.